partner suffer from erectile dysfunction? Is erectile dysfunction affecting your sex life? If so, stay tuned as we'll be talking about the most common causes of erectile dysfunction and how to treat it.
Welcome to Afro Netizen from BTS Podcast. My name is Beno Real, and if this is the first time you're watching our video, kindly subscribe and hit the notification button, as well as give this video a thumbs up. So on this episode of Health Awareness, I want to talk about one of the issues that is confronting African men: erectile dysfunction. Now, this is not associated with African men alone. It's just because this is Afro Netizen. That's why I'm sharing this content and directing it to African men all over the world. In fact, in America, the issue of erectile dysfunction is common. It cuts across all races. So, but let's focus only on Africans. Now, why am I emphasizing Africans? You know, as African men, we have pride, and oftentimes when we have this problem of erectile dysfunction, one of the things we rarely do is to go and see a doctor. We don't want to go and discuss our private business with a complete stranger, and that stranger in this case is the doctor. However, I have to be honest with you. If you are experiencing erectile dysfunction at any point in time, the best person to talk to is your doctor. You're going to have to go meet your doctor and let the doctor know that this is what is happening to me in the bedroom. Now, let's be honest. The joy of a marriage is having that ability to satisfy your woman. But at the same time, we also understand that as a man, as we grow from age 40 to 50 and 60, our energy level drops, and there's going to be some other stress as well as psychological issues, other pressures that is kind of draining our energy. But then every now and then we still want to get into the bedroom and do a human's job. But if that's not the case, if a man is experiencing stuff like premature ejaculation, or maybe lasting only 2 to 5 minutes in the bedroom, there is no way you can satisfy a woman with that. And that is why it's very important you talk to a doctor. So in this episode of Health and Wellness, I'm going to play a video from Dr. Pinto, who is a British doctor who actually took his time to explain what causes erectile dysfunction as well as treatment options. And above all, I'm going to tell you again and again, see your doctor. Just go and talk to your doctor. Whatever is happening to you, a qualified healthcare professional, we know what to do, the kind of test they have to run on you, as well as treatments or medication they can prescribe in order to treat your condition. Now, watch the video, and please, if you're a woman, you know that your husband is having this issue. Just like I said, African circle, we don't like to discuss issues like this with anybody, but yet it's affecting a lot of men. So if you notice that your man is having any of this problem, maybe he's having premature ejaculation, or he can't get it up in the bedroom, or if he finally tries to get it up, he cannot sustain it for a long time, send this video to him. Let him listen to the advice from the doctor, and finally let him go and see his doctor. This is Afro Netizen, and my name is Beno Real. Now, listen to Dr. Pinto.
To JHP Medical, I'm Dr. Pinto, and I'm going to tell you all about erectile dysfunction and how to treat it. If you like this video, remember to subscribe and click the notification bell so you don't miss out on any of our latest videos. So what is erectile dysfunction? Erectile dysfunction, also known as impotence, is the inability to obtain an erection and sustain it for long enough to engage in sexual intercourse. Erectile dysfunction is a very common condition amongst men, particularly once you reach the age of 40. In most cases, the episodes are caused by stress, anxiety, lack of sleep, or excessive alcohol intake. For some men, these can be a single episode which can self-resolve and are often nothing to worry about. However, if you find that you or your partner are regularly suffering from erectile dysfunction, this may indicate a more concerning medical or psychological problem. In some cases, erectile dysfunction may also be associated with other medications you may be prescribed. So how will my doctor find the cause of my erectile dysfunction? During your consultation, your doctor will take a detailed history regarding your erectile dysfunction symptoms. A number of factors can also increase your risk for the development of erectile dysfunction, and each factor may need to be addressed individually. Lifestyle factors, which includes being overweight, or having a history of smoking, excessive alcohol intake, or illicit drug use. Your doctor will also want to review your mental health. They'll look at your anxiety and your stress, which can dramatically influence your ability to get and sustain an erection. For some patients, having a hormonal imbalance can play a role, such as having a low level of testosterone or suffering from diabetes. Some prescribed medications can also cause erectile dysfunction, such as antidepressants and some antipsychotic medication, certain blood pressure medications, and testosterone blocking medications, which are commonly used for prostate issues. If you have a history of cardiovascular disease, this may also indicate that the blood vessels supplying the penis are also affected. If you've had a history of injury or surgery to the genital area, or any conditions which may affect the nerves supplying the penis. Your doctor will also need to examine you and your genitals. You'll need to be assessed for signs of hormonal imbalances, nerve problems, along with measurements of your blood pressure and heart rate to assess your cardiovascular health. Will I need any investigations? Well, your doctor, depending on the presentation and findings from your examination, may consider performing some blood tests. These tests may help identify hormonal imbalances such as low testosterone levels, or even help to identify other conditions contributing to your erectile dysfunction, such as diabetes. So what treatment is available for erectile dysfunction? Okay, your doctor has diagnosed you with erectile dysfunction. What can be done to help? Thankfully, treatments for the management of erectile dysfunction are effective in the vast majority of patients. However, it is important to recognise that the management of each patient's erectile dysfunction is likely to be different and will be dependent on the individual cause. Where stress and anxiety are the precipitating cause, you may benefit from psychosexual therapy. Here you'll be given the correct tools to manage your anxiety and stress levels, which in turn should improve your mental well-being, but also the symptoms of erectile dysfunction. Your doctor, if relevant for you, will discuss the importance of improving lifestyle factors, such as reducing alcohol intake, stopping smoking, and avoiding drug misuse. Keeping your weight at a healthy level can also be beneficial, and either a dietitian or your own doctor can help you with this.
Oh yes, that's
Where a
good
medical cause can be identified, your doctor will advise you on the required steps to manage these conditions. For example, the use of medications to control your blood pressure and cholesterol to improve your cardiovascular health, which in turn improves your symptoms of erectile dysfunction. So what about medications? You've probably heard of Viagra, also known as sildenafil, perhaps one of the most famous medications to treat erectile dysfunction. This is a medication that's available on prescription from your doctor or via your local pharmacy. These medications are taken prior to intercourse and are effective in around 3/4 of patients. However, we would advise against purchasing this medication online, as there are many websites selling counterfeit products. Can I use a vacuum pump? Vacuum pumps work by sucking blood into the penis, and they may be an option for a patient who've not had great success with the medications. However, it can be a little bit traumatic and can cause a little bit of bruising. Are there any surgical options? Surgical options, of course, do exist in the form of penile implants. However, they come with surgery and their own risks. This option usually is reserved for those patients where other treatments have failed. If this is something that you wish to pursue and you've tried all the other options, you should discuss this with your regular doctor. They'll probably suggest a referral to a specialist at that point. Thank you for watching. We hope you have found this information useful. If you've enjoyed this video, why not subscribe, click the bell or write down below. Of course, this video does not provide any individual medical advice and is intended for informational purposes only. Do not consider this as a substitute for professional medical advice, diagnosis or treatment. Please don't ignore professional medical advice in seeking treatment because of something you've heard here. If you believe you may have a medical emergency, immediately call your doctor or ambulance.
All right. You heard it from Dr. Pinto right here. This is not an advice, or you should do any of the things that he recommended, but the best advice is for you to go talk to your doctor. However, the reason I play this particular video is just to allay the fears, you know, to help those men who are still struggling to go and talk to their doctor about their erectile dysfunction situation. I just want you guys to know that it is nothing new. It is not a big deal. Erectile dysfunction happens anywhere all over the world. And when men are in their 40s, 50s, it's common. One way or the other, you're gonna experience erectile dysfunction. And just like it said in the video, if you're smoking, drinking, or you're using drugs, there is high tendencies that you might be going through some of these health challenges. So I will draw the curtain here, and kindly share this video, subscribe to our channel, and please hit the notification button. Every week we release a video on health and wellness, and the purpose of that is to help create awareness within the African community. Now I'm gonna draw the curtain here. Like I said, my name is Beno Real. Please follow our channel on Facebook, and for those who gonna follow Afro-Netizen on Facebook, we also have a new group that is created. It's called Fitness Team. You can join our fitness team in order to participate in some other exercises that people are doing on their own and they are recommending on the platform, just for you to be healthy and to be fit. My name is Beno Real. See you in the next video.
Yeah, we the co-creators, #1 in Africa.